Did you know a simple melody can do what medicine sometimes cannot? Heal the brain? Welcome to Elder Secrets, where timeless wisdom meets modern science. In today's episode, we explore the mysterious power of music therapy, how it revives memory, soothes pain, and restores joy, especially in aging minds. Let's uncover the rhythm behind the healing. Stay with us.
Have you ever noticed how just a few notes of a song can instantly zap you back to a specific moment?
Oh, absolutely.
Or maybe how just humming a tune can help you focus when your mind feels, all over the place?
Mm-hmm.
And then there are those truly astonishing cases, stroke patients who literally can't get a single coherent sentence out, but they can just belt out an entire song perfectly clearly.
It's incredible, isn't it?
It is mesmerized. Let me paint you a picture here that really drives this home. Imagine an elderly woman, really deep into advanced dementia. She's just sitting there silently, seems totally lost,
Yeah, sadly familiar.
Her family's tried everything to reach her, but there's just nothing. No spark, no recognition. And then a music therapist walks in, starts playing a song from the 1940s, something from her youth.
Okay.
And something, well, it feels miraculous, happens. Her eyes light up. She starts swaying a little, then humming. And then, with this astounding clarity, she sings every single word of that song, a song she learned 70 years ago. For those few precious minutes, she's back. She's her again.
That's such a powerful image.
And that, right there, it's not magic. It's the profound, scientifically backed power of music therapy. We're talking decades of rigorous research showing music doesn't just make us feel good, it literally changes our brains, sometimes right down to the cellular level.
You've really hit on a powerful truth there, and that's exactly what we're going to explore in this deep dive. We'll delve into this fascinating intersection, where science meets art, music therapy, and its really profound healing effects on the human brain.
Yeah.
We're going to unpack the intricate science behind why music has this remarkable ability to rewire neural pathways, restore memories that seemed lost, and even help heal damaged brains.
So our mission for you, the listener.
Our mission for you is to provide a kind of shortcut to get you truly well-informed about how music therapy is revolutionizing treatment for conditions ranging from Alzheimer's disease, like you mentioned, all the way to autism. We want to give you those definite aha moments, but without you feeling like you're drowning in information.
Okay, when we talk about music having this healing power, it feels very modern, tied up with neuroscience and brain scans. But this isn't actually a new discovery, is it? It feels almost like humanity has always sort of instinctively known about this connection.
That's an excellent point. You're absolutely right. That intuitive link between music and healing, it's incredible, deep-rooted in human history. It spans millennia across basically every culture we know of.
Right.
Long before we had MRI machines or fancy neuroscience labs, ancient civilizations recognized this. They actively use music's profound influence on well-being.
Can you give some examples?
Sure. Think about the ancient Greek physicians. They weren't just handing out herbs or recommending exercises. They were specifically prescribing certain types or modes of music to address mental disorders. They genuinely believed it could restore balance within a person.
Wow. Prescribing music.
Exactly. Or consider indigenous shamans. For thousands of years, they've woven rhythmic drumming and chanting into their healing ceremonies. They understood, maybe not in our modern terms, but they knew these sounds could shift consciousness, promote communal healing, even help with physical recovery.
It wasn't just spiritual then?
Well, it was often integrated, but there was a perceived therapeutic effect. Even look at medieval Europe. Those Gregorian chants in monasteries. Beyond their religious role, they were actively used as a form of therapy for the mind and soul, meant to bring tranquility and focus.
What's truly fascinating about those examples is, like you said, these ancient practitioners, without any of our modern scientific frameworks, somehow just knew. They intuited music's unique power to get inside the brain, to influence it in ways other things just couldn't. It's almost like we've always instinctively known music held some kind of secret key.
That's a great way to put it, a secret key.
So while this intuition has always been there, floating around, how did it eventually morph into the formal, structured field we call music therapy today?
Right, that's the crucial transition. While that intuitive connection is ancient, the formal field of music therapy as a recognized discipline really started to come together during World War I and especially World War II.
Okay, so relatively recently in the grand scheme.
Exactly. Picture this. During those wars, musicians wanted to help, so they'd volunteer, go into hospitals, and play live music for wounded soldiers.
Just to cheer them up, presumably.
That was probably the initial thought, but doctors and nurses started noticing something much more profound. This wasn't just entertainment. They were seeing undeniable, sometimes dramatic, improvements in the soldiers' physical and emotional responses.
Like what?
Patients who had musicians visit seemed to heal faster. They often needed less pain medication, and their overall morale, which is so critical for recovery, got a significant boost. The direct observations, the empirical evidence on the wards was just too compelling to ignore.
They could literally see it making a difference.
Precisely. And this observable impact was so profound it led to a major milestone. The first formal music therapy degree program was established at Michigan State University back in 1944.
Okay, so that's the official start academically.
That really marked the pivotal moment. Music's role in healing started shifting from just intuition and stories to a recognized, structured academic and clinical discipline. But, even then, while they saw the effects, the why, the underlying neurological mechanics was still largely a mystery, a black box.
Right, they knew it worked, but not how.
Exactly. It wasn't until modern neuroscience came along, with sophisticated tools like fMRI and EEG brain imaging, that we really started to peel back the layers to understand the intricate biological reasons why music has these profound therapeutic effects. The brain started revealing its own symphony, you could say.
That's where it gets truly mind-bending, isn't it? To really grasp why music therapy works, we first need to get our heads around what actually happens in your brain when you just hear music, because it's unlike almost anything else you experience.
That's the key.
Music doesn't just, tickle one little spot in your brain. It activates multiple regions all at the same time. When you listen to a song, you're not just processing sound in one place, you're lighting up networks across your entire neural landscape. What exactly is going on in there?
That's the absolute crux of it. The real aha moment here is understanding that music isn't just pleasant background noise. It's like a master key for your brain. It engages more of your brain all at once than almost any other single thing.
A master key, I like that.
Yeah. So when music enters your ears, it doesn't just hang out in your auditory centers. Sure, the sound waves hit your auditory cortex in the temporal lobe where they get processed into patterns we recognize. But within milliseconds, it's way more than just sound.
Yeah.
Your frontal cortex, the bit responsible for analysis, planning, executive function, it jumps right in, starts making sense of the music's structure, its meaning.
So the thinking part gets involved immediately.
Immediately. And simultaneously, your limbic system, that really ancient, deep emotional center, it's evaluating the music's emotional vibe, right? Triggering those feelings that just well up when you hear a certain tune.
Goosebumps moment.
Exactly. And you know how you might tap your foot or nod your head without even thinking?
Yeah, it happens all the time.
That's your cerebellum and your motor cortex actively processing the rhythm and the beat. Meanwhile, your hippocampus, which is critical for memory, is busy doing two things: encoding new musical memories, and maybe even more powerfully, retrieving experiences from your past that are linked to that music.
Wow, okay, so memory too.
Big time. And if there are lyrics involved, then your language centers, like Broca's and Wernicke's areas, they're firing up too, processing every single word.
So it really isn't just hearing then. It's a full-on brain concert happening inside your head. That widespread activation, that must be its superpower.
Exactly. Neuroscientists often call this whole brain activity, and it's genuinely remarkable. Very few other things can light up such widespread neural networks all at the same time. And this extensive simultaneous activation is precisely one of the core reasons why music therapy can be so incredibly effective for such a broad range of conditions.
Because it's accessing everything at once.
It's literally accessing and exercising multiple crucial brain systems simultaneously, creating this really rich, multi-dimensional neural experience.
And what's even more fascinating, from what I understand, is that your brain isn't just sitting back passively listening when music plays. It's actually actively involved in predicting what's coming next. Can you explain that bit?
Absolutely. This is where it gets even more intriguing, I think. Your brain isn't just receiving the music. Your neural networks are constantly, tirelessly trying to anticipate what's next. The next note, the next beat, how that melody is going to resolve.
Like trying to guess the next line of a song?
Sort of, but on a much faster, more subconscious level with the musical patterns themselves. And this continuous process, predicting the music and then hearing whether the prediction was right, it creates this unique form of neural exercise. It actually strengthens the connections between different brain regions.
Okay, so the brain is working out.
It really is. And get this, functional MRI studies, fMRI scans, have shown that when we listen to music we enjoy, our brains release dopamine.
Ah, the pleasure chemical.
That's the one. The same neurotransmitter involved in everything from eating delicious food to falling in love. But here's the real kicker, and this is a profound insight. The brain doesn't just release dopamine when the musical climax or the satisfying resolution hits. It releases it in anticipation of it.
Before it even happens.
Yes. Your brain literally gets a chemical reward for successfully predicting the musical patterns. It feels good to get the music.
That's wild.
It is. And this isn't just about feeling good, it's about active cognitive engagement and reward. This predictive processing is a fundamental reason why music therapy can be so effective, especially for people with various neurological conditions. It provides this highly engaging, inherently rewarding form of cognitive workout that strengthens the neural pathways we already have and, crucially, can even help forge entirely new ones. It's like brain training, but with a built-in feel-good factor.
Okay, so if music is literally creating and strengthening these connections in the brain, that brings us smack into the core concept of neuroplasticity. Now, for a long time, most of the 20th century really, scientists thought the adult brain was pretty much fixed, set in stone, you damage it, that's it. But we know that view is just wrong. So what does this all mean for us, for you listening?
It means the human brain keeps this remarkable, truly profound capacity for plasticity, for change throughout our entire lives. Even as adults, our brains can physically reorganize themselves. They can form new connections between neurons. They can strengthen the connections we already have. And in certain specific brain regions, they can even generate entirely new neurons.
Wow. Still making new brain cells as adults.
In some areas, yes. And this incredible ability of the brain to adapt, to reorganize, to literally rewire itself, that's neuroplasticity. And it is the absolute foundation of all learning, all memory formation, and critically, it's the foundation for recovery from any kind of brain injury. It's the brain's inherent superpower, you could say.
The brain's superpower. I love that. So how does music therapy actually harness this? How does it leverage neuroplasticity to heal and restore function?
Precisely. Music therapy taps into this neuroplasticity in uniquely powerful ways. Think back to that whole brain activation we just talked about.
Right, lighting everything up.
When music stimulates multiple brain regions all at once, it's not just making them flash on a screen, it's actively strengthening the physical connections, the synapses between them. There's this core principle in neuroscience, often summed up as neurons that fire together, wire together.
There, that one.
Music is brilliant at creating these robust, simultaneous firing patterns across different brain networks. This leads to stronger, more efficient connections between those neurons. And that strengthening is the physical basis of learning and adaptation in the brain.
Okay, so it's like paving neural highways.
That's a great analogy. And this is absolutely crucial for people recovering from brain injuries like a stroke. When a stroke damages one area, sometimes other healthy regions can actually take over those lost functions. It's a process called cortical remapping.
The brain reroutes itself.
Exactly. And music therapy acts like a potent catalyst, speeding up this remapping process. By providing this rich, multisensory whole brain stimulation, it encourages those healthy brain regions to forge new connections, to effectively compensate for the areas that were damaged. It's like building those new roads around the damaged bridge, making sure the traffic of information can still get through.
Is there research showing these physical changes?
Oh, yes, absolutely groundbreaking research. Dr. Gottfried Schlug at Harvard Medical School, for example, he's done extensive studies showing that intensive musical training literally changes the physical structure of the brain.
You see it on a scan.
You can. Professional musicians, for instance, have measurably larger corpus callosums. That's the thick bundle of nerve fibers connecting the brain's two hemispheres. They also show increased gray matter density, more brain cells, in areas crucial for motor control, auditory processing, and spatial coordination. These aren't just subtle shifts, they're significant structural differences.
That's incredible. A physically transformed brain.
Yeah.
Well, okay, what about the rest of us? You know, those of us who aren't professional musicians. Does just listening, or maybe dabbling a bit, still make a difference for neuroplasticity?
That's the truly hopeful part, yes. You absolutely do not need to be a concert pianist or a violin virtuoso to get these neuroplastic benefits. Even relatively short-term musical interventions can promote significant brain plasticity.
Really?
Yeah, there was this fascinating study, for example. They took elderly participants, none of whom had any prior musical experience. They gave them piano lessons for just 4 months.
Okay.
At the end of that short period, compared to a control group who didn't get the lessons, the piano group showed increased activity in brain regions specifically linked to attention and working memory. Just 4 months.
Wow, that's not long at all.
It really isn't. It just highlights the brain's incredible adaptability, its plasticity at any age, and it's this profound understanding of neuroplasticity that allows music therapy to be such a powerful catalyst for healing, for recovery, and even for cognitive enhancement throughout our lives. So now, let's look at some specific, real-world examples of this incredible capacity for change in action.
Okay, yes. This is where the science translates into those tangible, often life-changing results, where the profound real-world impact truly shines. Let's dive into how music therapy is actually used for specific conditions, because some of the stories here are just, well, they're nothing short of inspiring.
Absolutely.
First up, let's talk stroke recovery, specifically rebuilding language and movement. We touched on this earlier, that truly astonishing paradox. Many patients who suffer severe aphasia, and just to remind everyone, aphasia is where stroke damage makes it impossible to speak coherently. Many of these patients can still sing, like entire songs, perfectly clearly. Even when they can't manage a simple hello, it's baffling. Why? How?
It is baffling, and the key lies in how the brain handles these tasks differently. Speaking, for most people, primarily relies on language centers located in the left hemisphere of the brain. But singing involves much more distributed networks spread across both hemispheres.
So he uses different circuits.
Exactly. Music essentially provides an alternative pathway, one that might still be intact even when the primary language centers are damaged. And music therapists cleverly exploit this difference using a technique called melodic intonation therapy, or MIT.
Okay, MIT. How does that work?
So instead of trying to force spoken words out through those damaged areas, the therapist teaches the patient to sing their words, using simple, often repetitive melodies and distinct rhythms.
Singing instead of speaking.
Right. And as the patient practices singing these phrases and sentences, those alternative bihemispheric singing pathways get stronger. Over time, for many patients, there's a gradual transition. They start by singing the words, then it becomes more like sing-song speech, and eventually they might be able to speak the words more normally. The musical framework acts like a scaffold, literally helping to rebuild their language abilities, but from a different angle, using different brain resources.
So the music is retraining the brain.
Precisely. And the science backs this up beautifully. Brain imaging studies, like fMRI scans, clearly show that when stroke patients practice MIT, they're not just reactivating their damaged left hemisphere language areas, if they even can. They are actively recruiting regions in the right hemisphere, areas that weren't typically involved in language processing before the stroke. The musical elements, the melody, the rhythm are helping to forge brand new neural pathways that can compensate for the ones that were damaged. Dr. Andrea Norton at Harvard, her research shows this dramatically. Her brain scans of stroke patients undergoing music therapy reveal striking increases in the white matter connections, the communication cables, between the two hemispheres. Music therapy is helping to physically rebuild the brain's critical communication networks.
That's incredible, rebuilding the brain's wiring. Now, it's not just about language, is it? I've also seen these amazing examples of music helping people move again after a stroke. How does that work?
It's equally impressive on the motor side. This is where a technique called rhythmic cueing comes into play. Basically, patients synchronize their movements like walking or arm movements to a steady musical beat.
Like marching to music.
Exactly like that, but often more tailored. This helps restore smoother walking patterns and significantly improves coordination. You can find videos online, they're quite remarkable, of stroke patients who are really unsteady, maybe shuffling, unable to walk smoothly on their own. But then a clear rhythmic beat starts playing.
And they just start walking normally.
Often, yes,
Yeah.
perfectly in time with the music. It's because the brain has this natural tendency to entrain, to lock onto rhythm. That external musical beat provides a clear, consistent timing mechanism that can substitute for the internal timing systems that might have been damaged by the stroke.
So the music acts like an external pacemaker for movement.
That's a perfect analogy. And crucially, with consistent practice, many patients start to internalize these rhythmic patterns. They learn to generate that steady rhythm internally again and gradually regain more independent mobility even without the music playing. The music isn't just making them move in the moment, it's retraining their brain to find new, viable ways to control movement effectively.
That's just so powerful. Okay, let's shift gears now to maybe the most emotionally striking application of music therapy. Its power to reach people with Alzheimer's disease when almost nothing else seems to work. We talked about that incredibly moving example in the intro, and it's a phenomenon that it gets you right here. What makes music so uniquely persistent, so resilient in the face of such devastating memory loss?
It is truly one of the most poignant and honestly hopeful applications. The reason music can often break through the fog of Alzheimer's when other stimuli fail lies in the unique way our brains seem to store musical memories. While Alzheimer's disease progressively damages brain tissue, causing memory loss and cognitive decline, it doesn't affect all brain regions equally or at the same rate.
Okay, some areas are spared longer.
Exactly. And crucially, the brain areas involved in processing and, importantly, storing musical memories, particularly parts of the cerebellum, and specific regions within the temporal lobe, these seem to be among the very last areas to be significantly affected by the disease's progression.
So the music library stays intact longer.
That's a great way to think about it. It means that even in advanced stages of Alzheimer's, when individuals might have lost most of their autobiographical memories, they might not recognize loved ones or remember major life events, their ability to recall and respond to music often remains remarkably intact. Someone might not remember their own children's names, tragically, but they can still hum or even sing every word to songs they learned decades and decades ago.
That's just mind-blowing.
It is. And what's more, these musical memories aren't just floating there in isolation. They're often deeply, deeply intertwined with emotional memories and autobiographical memories. When we hear a song from our past, especially from our youth, it doesn't just activate the auditory memory of the tune itself.
Right, it triggers other stuff.
It triggers a whole cascade of associated experiences, where you first heard it, who you were with, how you felt in that moment, what was happening in your life back then. Neuroscientists talk about something called the reminiscence bump. The reminiscence bump. It's this well-documented phenomenon where people tend to have the strongest, most vivid, most emotionally charged memories from the period between roughly ages 10 and 30.
Or formative years.
Exactly. And not coincidentally, this is also the period when most people form their strongest musical preferences and embed those musical memories deep within their neural networks, intertwined with their developing identity and significant life events. Music becomes part of who we are.
Okay, so in a therapy setting, how do music therapists actually use this knowledge? What kind of transformations do they actually see happen?
In a therapeutic setting, it's all about personalization. Music therapists work closely with the individual and their families to create highly personalized playlists. These aren't just random old songs, they're tunes specifically chosen based on that person's unique musical history and known preferences.
Tailored to them.
Absolutely crucial. And when these deeply familiar, personally meaningful songs are played, something remarkable often happens. They can temporarily restore access to memories, to emotions, even to aspects of personality that seemed permanently lost.
Like in the intro example.
Precisely. Patients who haven't spoken coherently in months might suddenly begin singing along, word perfect. Those who have become withdrawn, seemingly unresponsive, might start moving to the rhythm, maybe tapping their feet, maybe even making eye contact, which is huge. Sometimes they might even engage in brief but meaningful, coherent conversations triggered by the music.
That documentary, Alive Inside, showed that so powerfully.
It really did. That scene with Henry, who appeared almost catatonic. Then they put headphones on him playing his favorite Cab Calloway music, and he just comes alive. He becomes animated, articulate, discussing the musicians, sharing memories with this incredible clarity. It's unforgettable.
It truly is. Is there brain science explaining that moment of clarity?
Yes. Neuroimaging studies confirm what we see. Familiar, personally significant music activates a whole network of brain regions. It includes the hippocampus, which is vital for memory retrieval, the amygdala, the emotional processing center, and parts of the prefrontal cortex involved in attention and social cognition. This widespread activation seems to temporarily restore or bypass some of the neural communication pathways that have been disrupted by the disease.
So it's like the music briefly reconnects things.
That's a good way to visualize it. Now, it's vital to be clear, these interventions don't cure Alzheimer's. The underlying disease is still there. but they significantly, profoundly improve the quality of life, not just for the patient, but for their families and caregivers too. Regular music therapy sessions can demonstrably reduce agitation and anxiety, which are common and distressing symptoms. This can lead to a decreased need for powerful antipsychotic medications, which often have significant side effects. And maybe most importantly, they provide these precious, invaluable moments of connection, of recognition, of shared humanity that can feel like finding an oasis in a desert. It brings light back.
Incredibly moving. Okay, moving on to another area where music therapy has a really significant impact. Working with individuals on the autism spectrum. This seems like a case where therapy leverages unique strengths in often surprising ways. How exactly does music help bridge communication gaps for individuals with autism?
That's right, it's often a fascinatingly good fit. Many individuals with autism spectrum disorder experience challenges with social communication and interaction, as well as restricted interests or repetitive behaviors. However, they also frequently exhibit remarkable strengths, often in areas like pattern recognition, attention to detail, memory for systems, and sensory processing, sometimes having heightened auditory perception.
Strengths that align well with music.
Exactly. These cognitive strengths align naturally with perceiving and producing music, which is all about patterns, structure, sequence, and sensory input. This makes music a unique and often less intimidating, less overwhelming avenue for therapeutic intervention compared to, say, direct verbal social skills training.
So it's a different way in.
A different, often more comfortable way in. For individuals with autism who are nonverbal or have limited verbal communication, music can become a powerful alternative communication system. They might learn to express emotions nonverbally through playing instruments, banging a drum loudly for anger, playing soft notes for sadness. They might respond consistently to musical cues in ways they don't respond to spoken instructions. Or they might even learn to use specific songs or musical phrases to communicate basic needs and preferences in a structured, predictable way.
That structure seems key.
It really is. The inherent rhythmic and repetitive nature of much music strongly appeals to many individuals with autism, providing a sense of comfort, predictability, and order in what can often feel like a chaotic sensory world. Music therapy sessions can create this very structured, safe, predictable environment where social skills can be practiced and gradually developed, but without the intense, often anxiety-provoking pressures of typical face-to-face verbal interaction.
You mentioned heightened auditory perception.
Yes, research has consistently shown that many children and adults with autism possess enhanced pitch discrimination abilities. Some can identify absolute pitch or remember incredibly complex musical sequences after just one hearing. Music therapists are skilled at identifying and building on these existing strengths, using them as a foundation to foster communication and social engagement, rather than solely focusing on deficits.
So it's about finding that alternative route to connection, leveraging their natural abilities. Are there specific techniques music therapists use in this context?
Definitely. One very powerful technique is often called musical joint attention. It uses interactive musical activities specifically designed to encourage shared focus and social engagement between the therapist and the child, or between peers in a group setting.
Can you give an example?
Sure. A therapist might start a simple, steady rhythm on a drum. Then they might use eye contact, gestures, or musical cues to invite the child to join in, perhaps playing the same rhythm on another drum or taking turns playing back and forth.
Like a musical conversation.
Exactly, a nonverbal musical conversation. As the child becomes comfortable with this basic interaction, the therapist can gradually introduce variations that require the child to pay closer attention to social cues, like watching the therapist for when to start or stop, or matching changes in tempo or volume.
And this helps with social skills generally.
That's the goal, and often the outcome. The idea is that these skills learned within the motivating, structured context of music can generalize to non-musical social situations. A child who learns the back and forth of musical turn-taking might start to better understand turn-taking in conversation. Someone who learns to listen and match a partner's musical rhythm might develop a better ability to synchronize their actions with others in everyday activities, like playing games or working collaboratively.
What's happening in the brain during this?
Well, the exact brain mechanisms are still being actively researched, but studies suggest that musical training, especially interactive musical training, may strengthen the neural networks involved in social cognition. Some research points to increased activity in brain regions like the anterior superior temporal sulcus, which is known to be crucial for processing social information, like interpreting biological motion or understanding intentions from actions. So music really helps bridge those communication gaps by meeting individuals where their strengths lie and providing a structured, motivating path towards greater social connection.
Let's talk about mental health now. The effects of music therapy on conditions like depression and anxiety seem incredibly profound, too. Feels like music has this unique ability to sort of bypass some of the cognitive roadblocks, the negative thought patterns that often keep people stuck in distress. It gets straight to our emotional core somehow. How does that work?
You've hit on a really crucial aspect there. When someone is experiencing, say, depression, their thoughts often get stuck in these negative, repetitive, ruminative loops. It's hard to break out of them just by thinking differently. Music, however, can powerfully interrupt these cognitive patterns and provide almost direct access to different emotional states.
How?
Well, for instance, listening to uplifting music that you find uplifting, it's quite personal, has been shown scientifically to increase dopamine release in the brain's reward centers. That gives you a natural neurochemical boost that can genuinely counteract some depressive symptoms like low motivation or anhedonia, the inability to feel pleasure.
So happy music can actually make you feel better biochemically.
It can contribute, yes, but it's not just about forcing happy music on people. Music also provides this incredibly safe and powerful container for processing difficult emotions. Listening to sad or melancholic music, when chosen purposefully by the individual or with a therapist, can be incredibly validating. It can make someone feel understood, less alone in their pain. It can provide a profound sense of cathartic release, a way to feel and move through sadness in ways that purely talking about it sometimes can't quite reach.
So it helps process the tough stuff, too.
Absolutely. And then there's active music making. Whether it's singing, playing an instrument, even just banging on a drum, this demands focused attention in the present moment. You have to concentrate on the rhythm, the notes, your breath if you're singing. This focus is a powerful antidote to anxious thoughts, which are usually about the future, or depressive ruminations, which are often stuck in the past. It pulls you into the here and now.
Like a form of mindfulness.
Yeah, very much so. Plus, group musical activities like choirs, drum circles, jam sessions, they inherently provide social connection and a shared sense of purpose. And we know that social isolation is a huge factor in many mental health conditions. Making music together combats that directly, creating bonds and a sense of belonging.
I've also heard about actual physical benefits from making music, like improving breathing or even supporting the immune system. Is that part of the mental health picture too?
It absolutely is. Physiologically, the act of singing, for example, requires deep, controlled breathing. This naturally regulates your breathing patterns, activating the parasympathetic nervous system, that's your body's rest and digest system, and promoting a state of calm and relaxation. It's very similar to breathing exercises used in mindfulness and meditation.
So singing can literally calm you down.
It can.
Yeah.
And research on group drumming specifically has shown some really interesting results. Studies have found it can significantly reduce cortisol levels, that's the body's primary stress hormone. It can also decrease inflammatory markers in the blood and even boost the activity of certain immune cells. There seems to be this primal, deeply regulating power in shared rhythmic activity that impacts our physiological stress responses at a very fundamental level.
Wow. Less stress, better immunity from drumming.
The evidence points that way. And one other really powerful tool in mental health music therapy is songwriting. The process of crafting lyrics, finding melodies to express personal experiences, emotions, struggles, it can unlock insights and facilitate emotional processing that might be incredibly difficult to achieve through traditional talk therapy alone. Clients often discover feelings, thoughts, or new perspectives through the creative act of songwriting that they simply couldn't access or articulate just by talking. It makes music a truly holistic pathway to emotional well-being and mental health recovery.
Okay, music also reveals another really remarkable therapeutic side when we look at its impact on movement control, especially in conditions like Parkinson's disease and also during rehabilitation from traumatic brain injuries. For Parkinson's patients, I've seen those videos, people really struggling to move, maybe frozen, and then a strong beat starts and they just move. smoothly. How is that even possible?
It is astonishing to witness, isn't it? And it's a direct, almost dramatic testament to music's power over our motor systems. Parkinson's disease, as you know, affects dopamine-producing neurons, leading to those debilitating motor symptoms. Tremors, rigidity, slowness, and particularly difficulty initiating movement, including those sudden, frustrating, freezing episodes where patients feel glued to the spot, utterly unable to take a step.
Right, the freezing.
Here, music, specifically rhythm, offers an almost instantaneous solution for many people. When Parkinson's patients experiencing freezing hear a strong, clear, external rhythmic beat from a metronome or rhythmic music, they can often immediately break free from the freeze and start walking again, often quite normally in time with the beat.
Instantly.
For many, yes, it's almost immediate. The external rhythm provides the precise, consistent timing cues that their own internal motor systems, compromised by the disease, can no longer reliably generate on their own. It's like the music gives their brain a clear external pulse, a pattern to latch onto and follow.
So it overrides the faulty internal signal.
In a way, yes. It provides an alternative, effective signal. And importantly, this isn't just a temporary trick that only works while the music is playing. Regular rhythmic training using music or metronomes can lead to lasting improvements in gait speed, stride length, and balance. Studies show that Parkinson's patients who participate consistently in music-based movement therapy demonstrate improvements that persist even after the music is turned off.
So the brain learns from the music.
Exactly. Their brains learn to internalize those rhythmic patterns and apply them to their voluntary movement control. Mechanistically, it's thought to involve bypassing some of the malfunctioning pathways in the basal ganglia, which are heavily affected in Parkinson's. Music seems to activate parallel motor pathways, alternative routes involving areas like the cerebellum and the supplementary motor area, which remain relatively intact. These areas can take over some aspects of movement control when they're effectively guided and prompted by those strong rhythmic cues.
That's why dance helps too.
Precisely. Dance therapy, particularly styles with strong rhythms and structured steps like tango, has shown profound results. It improves balance, significantly reduces the risk of falls, and enhances overall quality of life for people with Parkinson's by combining the benefits of rhythm, complex coordinated movement, and essential social interaction.
Okay, and for traumatic brain injury, TBI, which often has such widespread, diffuse effects across the brain.
Oh.
How does music therapy tackle that broad range of challenges?
For TBI, music therapy is uniquely beneficial precisely because TBI often causes that kind of diffuse damage, affecting multiple brain systems simultaneously: cognition, movement, emotions, communication, you name it. Unlike some traditional therapies that might need to focus on one specific deficit at a time, music therapy's inherent whole brain activation allows it to address multiple cognitive, emotional, and physical deficits concurrently within the same session.
So it's efficient.
It can be very efficient and also highly motivating. For TBI patients dealing with cognitive impairments, issues with attention, memory, executive function, structured musical activities provide excellent, engaging exercises. Learning new songs requires sustained attention and actively uses working memory. Playing instruments, even simple ones, demands fine motor control, sequencing, and cognitive planning.
And the emotional side. TBI can be devastating emotionally.
Absolutely critical. TBI often leads to significant depression, anxiety, frustration, and sometimes a profound loss of identity, feeling like you're not the same person anymore. Music can be a powerful way for patients to reconnect with aspects of themselves that survived the injury, maybe rediscovering a past love for music or finding new ways to express themselves. This can provide a vital sense of purpose, competence, and self-worth during a very difficult recovery process.
Can you share an example?
Sure. There was a case study of a former drummer, let's call him Marcus, a 35-year-old who sustained a significant TBI. He was struggling with cognitive sequencing, bilateral coordination, using both sides of his body together, and understandably, his mood and sense of self were very low. His music therapist started using drumming activities.
Getting him back to his roots.
Exactly, but strategically. The drumming exercises were designed specifically to target those sequencing and coordination deficits. And what happened was, his drumming improved, yes, but those improvements generalized. His speech became more fluent, his walking pattern improved, his mood lifted significantly. The music therapy was instrumental in him eventually being able to return to part-time work. It helped him rebuild cognitive skills and reclaim a core part of his identity.
That's amazing. Any hints of deeper repair?
Well, it's still early days, but some preliminary research is even suggesting that musical training might promote neurogenesis, the actual growth of new neurons in certain parts of the adult brain. If that holds up, it hints at even deeper, potentially regenerative effects of music. So overall, music therapy offers this really holistic, powerful, and often deeply meaningful approach to TBI rehabilitation.
Okay, if we sort of zoom out now, connect this to the bigger picture, it feels like music therapy's impact goes way beyond just treating individual conditions. It's used to fundamentally influence our social connections, our group behavior, maybe even our basic biology in ways we're only just beginning to really map out. Is there a kind of social neuroscience angle to all this?
Well, absolutely. You're spot on. Music is, at its core, inherently social. If you look across human history and cultures, musical activities, singing together, dancing together, drumming together, have always been communal experiences. They are fundamental tools for strengthening social bonds, creating group cohesion, coordinating group activities. It's deeply woven into our evolutionary history as social beings.
We make music together.
We do. And when people actively make music together, something truly remarkable happens at a neural level. Research has shown their brain waves literally synchronize. It's a phenomenon called brain-to-brain coupling.
Our brains sync up. Seriously.
Seriously.
Yeah.
This neural synchronization seems to create this profound sense of connection, shared experience, and rapport that goes far beyond what we typically achieve through just talking or doing individual activities side by side. It fosters increased empathy, cooperation, and social bonding on a very deep, almost primal level. We literally get on the same wavelength.
That explains why singing in a choir feels so good.
It's definitely part of it. And this social dimension of music therapy is particularly vital for populations who often grapple with significant isolation and loneliness, like many elderly individuals. Group singing programs for seniors, for instance, have demonstrated remarkable benefits. They don't just improve mood and cognitive function, which they do, but they also positively impact overall health and even longevity, largely attributed to the powerful social connection and sense of community they provide. The social aspect is often just as therapeutic as the musical stimulation itself.
So it combats loneliness directly.
Powerfully. And you see this ripple effect elsewhere, too. Think about music therapy programs on pediatric hospital wards. They inject joy, hope, and normalcy into what can be a scary environment. These programs benefit not only the children directly involved, but also their anxious families and even the stressed healthcare workers. The positive social and emotional contagion of these shared musical experiences literally improves the entire healing environment.
That's wonderful. And it's not just neurological or social benefits, right? It seems music therapy's reach extends even further, impacting things like pain management, immune system support, sleep quality, even addiction recovery. It really feels like a multifaceted powerhouse.
It truly is remarkably versatile. Let's take pain management. Numerous studies have shown that musical interventions can significantly reduce both acute pain, like after surgery, or during a medical procedure, and chronic pain conditions.
How does music stop pain?
It seems to work through multiple mechanisms. Music can activate the brain's own natural pain-inhibiting systems, including the release of endorphins, which are like natural opioids. It can also modulate the descending pain pathways from the brain down the spinal cord. And perhaps more simply, but still effectively, it provides a powerful and engaging distraction from the discomfort. It literally takes your mind off the pain. That's why music therapy is increasingly being used in intensive care units, in post-surgical recovery rooms, and in cancer treatment centers. It often leads to patients reporting less pain, requiring less pain medication, and sometimes even having shorter hospital stays.
Less medication is huge. What about the immune system?
Yeah, that's a fascinating area. Research suggests certain musical experiences, particularly those that reduce stress and promote relaxation, can actually have measurable effects on the immune system. Studies have shown they can reduce levels of stress hormones like cortisol, which we know can suppress immune function over time. And some studies have even shown increases in the activity of natural killer cells, NK cells, which are crucial components of the immune system involved in fighting infections and even cancer cells.
Wow. So music could help fight disease.
Well, it's more about supporting the body's own defenses, especially during stressful times like undergoing chemotherapy or major surgery. Pilot programs are exploring using music therapy adjunctively to help bolster patients' immune responses and potentially improve treatment outcomes. It's about reducing the physiological toll of stress.
And sleep. Can music help us sleep better?
Definitely. Many people intuitively use music to wind down, but music therapists can design specific musical programs to help with sleep disorders. Specially composed or selected music, often with particular tempos and frequencies, can help regulate circadian rhythms, reduce the time it takes to fall asleep, sleep latency, and improve overall sleep quality and duration. This seems particularly beneficial for older adults who often struggle with sleep disturbances. Good sleep is so foundational for overall health.
Makes sense. And addiction recovery, how does music fit in there?
In addiction recovery, music therapy offers a powerful non-pharmacological tool. It provides a healthy and constructive alternative for managing stress, coping with cravings, and processing the difficult emotions that often underlie substance use. Active music making can help rebuild a sense of identity and self-worth that's often damaged by addiction. And crucially, group music therapy activities foster vital social connections and build a supportive recovery community, countering the isolation that can be a major trigger for relapse. It helps people find new sources of meaning, connection, and healthy pleasure.
This field sounds like it has immense potential, and it's constantly evolving. What does the future look like for music therapy, especially with all the rapid advancements in technology we're seeing everywhere?
It's an incredibly exciting time, no doubt about it. We're really entering an era where the traditional person-centered art of music therapy is starting to synergize with cutting-edge technology in really interesting ways.
Like what? AI, VR?
Exactly. Artificial intelligence, for instance, is beginning to enable highly personalized interventions that can adapt in real time based on a patient's physiological or neural responses. Imagine a system that monitors your brain activity via EEG or your heart rate variability and automatically adjusts the tempo, the key, maybe even the instrumentation of the music being played to optimize a specific therapeutic effect, like promoting relaxation or enhancing focus. Early versions of systems like this are already being developed and tested.
Wow, music that reads your mind.
Or at least your body's signals. Then there's virtual reality, VR. This opens up possibilities for creating incredibly immersive musical experiences. Think about someone practicing motor skills by conducting a virtual orchestra, or someone with social anxiety rehearsing, performing for a virtual audience in a safe, controlled environment before trying it in the real world.
That's clever.
We're also seeing combinations with other technologies. For example, researchers are exploring pairing music therapy with non-invasive brain stimulation techniques, like transcranial magnetic stimulation, TMS, to see if they can work together to enhance neuroplasticity effects even further, maybe boosting recovery after stroke or TBI. And wearable devices, smartwatches, biofeedback sensors could potentially deliver personalized musical interventions precisely when they're needed most, like detecting rising stress levels and proactively prompting a calming music session.
Okay, so the tech integration is huge. What about our deeper understanding of how it all works? Are we getting closer to the core mechanisms?
We are, definitely. If we dive deeper down to the cellular level, studies are showing that musical stimulation can actually affect gene expression within neurons. It seems it can upregulate or turn up genes that are involved in promoting neuroplasticity growth, repair, new connections, while potentially downregulating genes associated with neurodegeneration or inflammation, helping to protect the brain.
Music changing our genes.
Changing the expression of our genes, yes. How active they are. And beyond just dopamine, we're getting a much clearer picture of how music influences a whole symphony of other crucial neurotransmitter systems. It impacts serotonin, which is vital for mood regulation and sleep. It affects GABA, the brain's primary inhibitory neurotransmitter, promoting relaxation and reducing anxiety. And as we mentioned, it triggers endorphins, providing natural pain relief. It's like music taps into this incredibly sophisticated natural pharmacy of neurochemicals that we all have within us.
The natural pharmacy, I like that.
We're also learning that the specifics matter immensely. The timing of interventions might be crucial. Are there optimal windows based on our natural circadian rhythms? And the specific musical parameters is a certain type of rhythm best for motor rehab. Is a particular harmonic structure better for emotional regulation? Researchers are working hard to dissect these elements and optimize interventions for maximum benefit based on the condition being treated.
That's incredible, the level of detail. Tuning the music right down to the cellular level and the specific brain chemicals, how does that intersect with something much more subjective, like our individual musical preferences? Does it matter if I like classical and you like rock?
That's a huge and really important area of ongoing research and clinical practice, the neuroscience of musical preference and how it relates to therapeutic response. We absolutely know that individual differences in musical taste are significant, and these preferences aren't just random. They're linked to our underlying brain structure and function, our personality traits, our cultural background, our life experiences.
So my playlist says something about my brain.
To some extent, yes. The ultimate goal here is to move towards truly personalized music therapy. The dream is to be able to tailor interventions not just based on the condition, but on the individual's unique neural profile, integrating data from their musical preferences, their personality assessments, their cognitive strengths and weaknesses, maybe eventually even their genetic predispositions, to design the most effective possible musical prescription for their specific therapeutic needs. It's about finding the perfect musical key to unlock your unique brain's potential for healing and growth.
Wow. That's a fascinating future vision. And it's not just about fancy tech or future possibilities, right? It's also about applying music therapy thoughtfully across the entire human lifespan, recognizing that our needs and how we respond to music change as we grow in age. It sounds like music really has something to offer everyone at every stage.
Absolutely. It's a lifespan approach. From the very beginning of life in infancy and early childhood, music therapy plays a vital role. Think about lullabies, playful songs. These aren't just cute. Music therapy techniques foster crucial early bonding between caregivers and infants, help babies learn emotional self-regulation, and support early language development through interactive musical play. It sets foundations.
And for teenagers, music is huge for them.
Huge. For adolescents, music often becomes a central part of exploring their identity, expressing intense emotions that can be hard to talk about, and navigating complex social relationships. Music therapy techniques like songwriting, lyric analysis, and group improvisation can be incredibly powerful outlets during those turbulent years.
In adulthood,
The focus might shift towards things like stress management, maybe performance enhancement for some, and increasingly addressing specific physical or mental health conditions as they arise, using all the approaches we've discussed.
and for older adults, we talk about Alzheimer's, but more broadly.
For older adults, music therapy is invaluable for maintaining cognitive function, helping manage chronic conditions like Parkinson's or pain, facilitating life review and reminiscence, which can be incredibly meaningful, and combating loneliness and depression through group music activities. It supports aging well. So yes, each stage of life really requires specifically adapted approaches, goals, and ways of measuring success to ensure the therapy is truly effective and relevant. And crucially, we must not overlook the global perspectives here. While we've talked a lot about Western scientific approaches, the understanding that music heals is universal, but its applications are profoundly influenced by cultural background. We need to be humble and learn from these diverse traditions.
Right, it's not just one way.
Not at all. Think about traditional Chinese medicine, which has for centuries associated specific musical scales or tones with different internal organs and emotional states, using sound for balancing energy. Or Indian classical music, where specific ragas are believed to evoke particular emotions and even have physiological effects, sometimes traditionally prescribed for healing. African musical traditions often emphasize communal, polyrhythmic drumming and integrated dance for healing ceremonies, focusing on group participation and spiritual connection. And indigenous traditions around the world often integrate music holistically with storytelling, ritual, and connection to the land as part of their healing practices. Modern music therapy has so much richness to gain by learning from and respecting these ancient, often deeply holistic approaches. It enriches our understanding and helps us practice in more culturally sensitive ways.
Okay, so this brings up a really important practical question. Given these profound, often complex, sometimes life-changing effects we've been talking about, what exactly qualifies someone to practice music therapy effectively and safely? It's clearly a highly specialized field, right? It's not just someone who likes music and has a good playlist on their phone.
Oh, absolutely not. It is indeed a rigorously regulated healthcare profession. Becoming a board-certified music therapist, MTBC is the credential in the U.S., for example, requires extensive specialized training in both music and clinical skills.
What does that training involve?
Typically, it starts with completing an approved bachelor's or master's degree program in music therapy. These programs cover a lot of ground. Advanced music theory and performance skills, naturally, but also human anatomy and physiology, psychology, developmental psychology, research methods, and of course, specific music therapy assessment techniques and intervention strategies for various populations.
So science and art combined.
Exactly. And the academic coursework is only part of it. A crucial component is a supervised clinical internship, usually around 1,000–1,200 hours, where students gain hands-on experience working with real clients under the guidance of experienced, certified music therapists. That's where they really learn to apply the theory in practice. And finally, they have to pass a comprehensive national board certification exam.
So it's a serious qualification.
Very serious. And the clinical judgment developed during that whole process is paramount. Music therapists are trained not just to play music, but to systematically assess patients' needs, their physical, emotional, cognitive, social, and spiritual needs. Based on that assessment, they develop individualized treatment goals and then design specific musical interventions to target those goals. And importantly, they're also trained to recognize contraindications, situations where music therapy might not be appropriate or needs careful adaptation.
Like what kind of situation?
Well, for example, someone might have auditory hypersensitivity, where certain sounds are physically painful or overwhelming. Someone might have severe hearing impairments requiring visual or vibrotactile approaches. Certain psychiatric conditions might require careful consideration of lyrical content or musical styles that could be triggering. There might be cultural or religious beliefs about music participation that need to be respected, or physical limitations that affect a person's ability to play an instrument or move to music. A trained therapist knows how to navigate these complexities safely and ethically. And, like all credible healthcare professionals, they're required to engage in ongoing continuing education throughout their careers to stay current with the latest research findings and best practices. It's about combining deep musical artistry with rigorous clinical expertise and ethical awareness.
That really clarifies the professionalism involved.
Which brings up another crucial point: the research itself, the evidence base. It's easy to see the anecdotal impact, like with Henry in Alive Inside, and feel convinced. But how do scientists rigorously measure the effects of music therapy, especially when, as you pointed out, you can't exactly give someone a placebo song in the same way you give a sugar pill?
That's a really perceptive question, and it highlights one of the genuine methodological challenges in music therapy research. Blinding is difficult, right? Unlike in pharmaceutical trials, where you can give one group the real drug and another group an identical-looking placebo, and neither the patient nor the researcher knows who got what, double blinding, it's pretty much impossible to blind someone to whether they are receiving music therapy or not. They know if someone is singing with them or not.
Right. So how do researchers deal with it? They've developed several creative and rigorous solutions. One common approach is to use active controls instead of inert placebos. So the control group doesn't just sit there doing nothing. They engage in another activity that is designed to be equally engaging in terms of time and attention, but doesn't involve the specific therapeutic elements of music. Maybe it's participating in visual art activities, listening to audiobooks, engaging in guided reminiscence without music, or simply having friendly conversation.
Comparing music therapy to something else active.
Exactly. This helps researchers try to isolate the specific effects of the musical components from the more general benefits of simply receiving therapist attention, engaging in a pleasurable activity, or having social interaction. It strengthens the conclusions we can draw.
What about measuring the effects objectively?
That's where neuroimaging studies have become incredibly valuable. Techniques like fMRI or EEG can provide objective biological evidence. They can literally show changes in brain structure, like increased gray matter or white matter connectivity, or changes in brain function, like altered patterns of activation in response to stimuli that result directly from musical interventions. This offers powerful biological validation for the clinical improvements that patients and therapists are observing.
Seeing the brain change seals the deal.
It provides very compelling evidence. Furthermore, the field relies heavily on meta-analyses. These are studies that statistically combine the results from multiple individual studies on a specific topic. By pooling the data, meta-analyses can provide much stronger, more reliable evidence for the overall effectiveness of music therapy across a wide range of conditions, overcoming limitations of smaller individual studies. The consensus from numerous meta-analyses is quite clear. Music therapy provides significant benefits.
Now, the evidence is robust despite the challenges.
It is robust and growing. However, challenges do remain. It's difficult to perfectly standardize interventions that are inherently designed to be individualized and responsive to the client in the moment. And developing outcome measures that can fully capture the multidimensional benefits, cognitive, emotional, social, physical, spiritual, is an ongoing process. But the field is deeply committed to evidence-based practice and continually refining its research methodologies. It's also worth touching on the economic considerations. While obviously there are direct costs associated with running music therapy programs, therapists, salaries, instruments, space, there's a growing body of evidence suggesting these costs can be offset by significant savings elsewhere in the healthcare system. Well, for example, if music therapy interventions can help stroke patients recover language or motor skills faster, that might lead to shorter hospital stays or reduced need for other forms of intensive rehabilitation. If music therapy effectively reduces agitation and behavioral challenges in dementia patients, it can decrease the need for costly antipsychotic medications, which often have serious side effects, and also reduce the amount of staff time required for managing difficult behaviors.
So it can save money overall.
That's the argument, and the evidence is building. Some forward-thinking healthcare systems, like the renowned Cleveland Clinic, have recognized this potential and have successfully integrated music therapy departments as part of standard care in many areas. Insurance coverage is also gradually expanding, although there's still a way to go, and effective integration relies on close collaboration. Music therapists don't work in a vacuum. They work closely as part of the interdisciplinary team alongside physicians, nurses, physical therapists, occupational therapists, speech therapists, social workers, and others to ensure a holistic, coordinated approach to patient care.
That makes sense. Now, beyond all the science, the training, the economics, there feels like there's another layer here, perhaps less tangible, maybe harder to measure, but equally crucial. And that's the therapeutic relationship itself, the connection between the therapist and the client. It seems like that human connection must amplify the effects of the music tremendously.
You've absolutely hit on a core truth of not just music therapy, but perhaps all effective therapy. While the music itself undeniably possesses intrinsic therapeutic properties, the rhythm entrains, the melodies evoke emotion, the structures engage cognition, the context within which that music is delivered is paramount. That caring, attuned, supportive relationship with a trained, empathetic therapist, it amplifies the music's effects exponentially.
So the therapist is more than just a music facilitator.
Oh, much more. Music therapists are not just skilled musicians who happen to work in healthcare settings. They are clinically trained therapists who use music as their primary tool. They learn to establish profound therapeutic rapport, often non-verbally through the music itself. They become incredibly skilled at reading subtle cues, a shift in posture, a change in breathing, a flicker of emotion in the eyes, and adapting their musical approach fluidly and instantaneously in response to the client's needs and preferences in that moment.
It's interactive.
Highly interactive. It's rarely just passive listening. Music therapy often involves ongoing musical communication, a kind of musical conversation happening between the therapist and the client, even if the client is nonverbal. The therapist might musically mirror or match the client's energy level or emotional state to build connection. They might provide specific musical prompts or structures to encourage participation or self-expression. They might engage in call and response musical dialogues, improvising together.
That sounds complex.
It requires incredibly sophisticated clinical judgment in real time, knowing precisely when to increase musical stimulation or when to decrease it, when to introduce a gentle challenge, or when to provide unwavering support and validation through the music. Therapists learn to consciously harness specific musical elements, tempo, volume, rhythm, harmony, melody, to intentionally influence mood, arousal level, attention, or social interaction, all in service of the client's therapeutic goals.
And does that relationship extend beyond the sessions?
Ideally, yes. A good music therapist also works to empower clients and their families to integrate therapeutic uses of music into their daily lives long after the formal sessions end. This might involve helping them create personalized playlists for mood regulation or relaxation, teaching family members simple musical ways to connect with a loved one, or connecting clients with community music groups for ongoing social support and engagement. The goal is sustainable well-being. And underpinning all of this is a strong commitment to quality assurance and evidence-based practice within the profession. Music therapists systematically evaluate the effectiveness of their interventions, constantly seeking ways to improve their practice. There's a growing emphasis on developing standardized assessment tools and clinical protocols where appropriate, while still allowing for necessary individualization. Professional supervision and peer consultation are vital for maintaining high standards, and integrating music therapy documentation into electronic health records is becoming increasingly important for tracking outcomes and facilitating seamless communication within the broader healthcare team.
Can you give one more example, maybe illustrating that bridge between therapy and function?
Sure. Think about Elena, an 8-year-old girl with autism we mentioned implicitly earlier. She had been nonverbal for years, despite various other therapies. Her music therapist started working with her, primarily using familiar children's songs with strong actions and animal sounds. During a rendition of Old MacDonald Had a Farm, focusing on the animal sounds, Elena suddenly, clearly, uttered her very first word. Moo. Just like that. That single music-elicited word became the crucial breakthrough. It was the bridge. The therapist built on that success, using highly motivating songs and musical structures to systematically encourage more vocalizations, then words, then simple phrases, all within the engaging musical context. Eventually, Elena began using spoken words functionally outside of the music therapy sessions as well. The music therapy didn't just teach her a word, it unlocked a pathway to communication, building on her strengths and interests, accessing an ability that was latent, and then carefully bridging it to conventional communication and function. That really illustrates a key principle. Music therapy meets people where they are, builds on their strengths, accesses lost or latent abilities via alternative pathways, and then helps bridge those gains back to everyday life, always honoring the whole person.
So after this incredibly rich, deep dive, what does this all really mean for us? For you, listening. It feels like the big takeaway is that music is so much more than just entertainment or background noise or even just art. It seems to be a fundamental form of neural communication hardwired into us that profoundly influences, shapes, and yes, even heals our brains.
That's a perfect summary.
And the fact that our brains retain this remarkable lifelong plasticity means that music isn't just for the young or the gifted. It's a powerful, accessible tool for growth, for learning, and for recovery at literally any age.
Indeed. What we've seen throughout this discussion is how music therapy skillfully leverages the brain's own natural tendencies. Its innate inclination to synchronize with rhythm, its surprising ability to access deeply stored, intact memory systems, even when other cognitive functions might be severely compromised, and its unique capacity to bridge our emotional experiences with our cognitive processes, integrating parts of ourselves that often feel separate. The evidence from neuroscience labs to clinical practice is really clear and compelling. It works across a vast and growing range of conditions, from neurological rehabilitation to mental health challenges to developmental support. And perhaps the most important underlying reason why it works so well is that music therapy inherently honors the whole person. It doesn't just target isolated symptoms or deficits. It engages the full, complex richness of our human experience, our emotions, our memories, our identities, our relationships, our creativity, and our inherent sense of purpose and meaning. It speaks to us on multiple levels simultaneously.
Connecting all the dots.
Exactly. And as we look towards the future, this exciting convergence we're seeing, the blending of ancient wisdom about music's power with cutting-edge neuroscience uncovering the mechanisms and innovative technology offering new delivery methods, it really promises even more effective, more personalized, and more culturally sensitive musical interventions to come.
So a call to action, perhaps. For those of you listening who might be healthcare professionals, maybe this sparks an interest to learn more about how music therapy could potentially benefit your patients, how it could complement the work you already do.
Absolutely. Collaboration is key.
For family members out there, maybe caring for loved ones with some of the conditions we've discussed, perhaps explore how simple musical activities, singing familiar songs together, listening to meaningful music, maybe even gentle movement to rhythm, might enhance your caregiving, ease stress, and create those invaluable moments of connection and joy.
Those moments are priceless.
And really, for everyone else, remember this key point. You don't need to have a specific medical condition to benefit from music's inherent healing and regulating properties. The very same neural mechanisms we spent this time unpacking, the dopamine release, the brain synchronization, the emotional processing, the stress reduction, they operate within you every time you simply listen deeply to your favorite songs, or sing along in the car, or lose yourself dancing in your living room. Music is a resource for all of us. You know, it feels like the human brain and music didn't just meet by accident. They evolved together, intricately intertwined over vast stretches of time, creating these deep, resonant connections that we're only just beginning to truly understand scientifically. As we continue to unravel these fascinating mysteries, one thing remains brilliantly, beautifully clear. Music holds this profound power. Power to heal, power to transform, power to connect us to ourselves and to each other, and power to remind us of what it truly means to be gloriously, complexly, and wonderfully human. It really is a symphony of healing, and the amazing thing is we're all invited to participate. The music never stops. We just need to learn how to listen.